next talk. So at any point of time, please do stop us. We are very happy that we are having you here because you are our moral support. So we'll move to the next talk, the eye apps in ophthalmology. Over to you. So this is a presentation by Dr. Sathyan and Dr. Shruti. So over to them. Yeah.
So this is one of my favorite topics actually, because it's very simple, very free apps that we use to create, award-winning photographs so far. So these are all like award-winning photographs I'm showing. So it's all very simple tricks. I think if we were able to use it, it would be the best outcome that we can achieve. So our team's motto is that a picture can speak 1,000 words. So why does image editing and representation matter? So this is one of our personal edited images. So you can see it's a gonioscopy photo, but the way we present it is something that is unique, and it's not done before. So you need to create ideas which are unique for yourself. So start with the image acquisition. So it works well with how good you capture the image, because if the quality of image is going to drop beyond a certain level, no matter what we do with it, we are not going to be able to create the effect that we want it to have. And then build your own style. So as I was saying, we need to have our own unique style, our own unique story. As I tell your story the way you want it to be told, by the through collages, through editing, how exactly you want it to be. And no matter how small the adjustment, sometimes we might feel that brightness, saturation, contrast, how does it matter? But it matters a lot. And collage making is an art that we all have to learn, because right now we have all the tools at our fingertips. So we have to make sure that we use it for the utmost importance. So as I was saying about the image acquisition, so you can see that we never capture just photos. We always take videos, even for the minute details. We take videos of the cases from the start to end. So you can see that we start focusing from the cornea, we focus at the iris, we go to the lens. So that even if the patient moves their eye in between, we have a clear image which we can screenshot later. So most of the time we end up taking 5-minute videos so that we have immense number of screenshots which we can work on later. So similarly, if you can see, this is another video which we had stained. This is basically an MMC bleb to look for leakage. We had stained. So different focal points, because we know with slit lamp, even the minute movement, the focus will go off. So we have to take videos. That is the best way to capture an image. So ultimately, the end point of this image was, you can see here, this was one of our award-winning photographs in IRSA. So you can see that from this, we were able to capture these images. And obviously, these are multimodal imaging using OCT and Sheen-Fleck images. Another technique to bring about more life to your image is the multimodal imaging. So whichever way we can capture it in different settings, make sure it happens. So this is one of my personal apps, which is the POTO, which is available free in iOS devices. And for the past 3 years, this is the app which I have been using. So you can see that I'm just going to show a short video on how exactly I collage using the app. So once you go into your app and you can choose whichever number of images that you want to choose for collaging it. And the moment you choose it, it's going to give you a particular layout. So once the layout is there, now it's all with your touch interface. So you can just long touch them, and you can change the position. It gives you almost different types. I can imagine up to 50 combinations in which you can organize your images in the collage format. But choose it how you want it to be, based on what the story that you wanted to tell. Which image is going to get the maximum space, and which is going to be in order wise A, B, C, D. So choose the story you want to say and the format you want it to be. And once that is done, as I was saying, this is the format I chose finally. Now this was my primary image. So I just long pressed it, drag it and drop it. It just exchanges. That's it. And now I just need to resize these images so that they all look, in the same size. And I want the full image inside the box. It's all very simple. You can see how much we can work on this app. And it's free, completely free. You can use it. And one important thing, it does not reduce the size of your image. The quality of images stays the same, and you can download it directly from your phone onto your laptop. And finally, as I was saying, the margins and the inter-image spaces, it has to be very neat. And finally, you need to give a very clean image. So it's very important that we do that. So you can see we have made the final adjustments, and in the end, we have the image that we want. Yeah. So similarly, as I was saying for the gonioscopy, so we do the gonioscopy with the video, and then I do screenshots of the different angles. And finally, you can see I have taken all the 4 angles. Same way through the different layouts in different ratios which are available, I go through them. And the best layout that is possible for it, I choose it. And finally, you can see that I'm going with the sort of a kaleidoscopic and a geometric view for the gonioscopy. And it's more clinically relatable also, the way I have adjusted the gonioscopy images. And you can see it's very simple to exchange images in between the frames. And finally, once that is done, readjust it so that you can see all the angles are coinciding with each other. And you can see the final image over here. As I was saying, again, the margins and the inter-image distances, and you're done. So once that is done, as I was saying, organizing your collage only when needed, because most often there are a number of images needs to be limited. So we think whatever image we are capturing, we'll put it onto a collage and give the reader or the viewer our entire database. But do not do that. Only when needed, do the collaging. Before collaging, edit each image separately. Very important. Do not edit your image after you do the collage. Then because different images will need different brightness, saturation, definition, etc. So this is, for example, a story that we are telling. Which basically, you can see it's PI has been done in this case. So right eye, left eye, and there's hyphema. So post PI, we are doing a gonioscopy, which shows open angles, and then we are doing a dilated examination. So that's how you tell a story with the collage. Similarly, proper annotation inside the collage, because you have beautiful images, but without annotating them, you're not going to point out to where you want the viewer to look at. So make sure you have proper annotations. And similarly, as I was telling, the size of the annotations, it should not be too huge or too small. It should all be organized within your collage. It should make sure that they're all aligned together as much as possible, and same color concepts, same for example, we're using an asterisk and arrow here. Make sure you stick to minimum number of annotations. And if annotations are not needed, do not unnecessarily use them. For this image, the only place where I needed the annotation was in the Sheen-Fleck image to show this ectropion tissue. Otherwise, remaining every other image was self-explanatory. And if you put more annotations, it's going to destroy the quality of your image. So follow-up images, similarly, as I was telling, try to align your annotations as much as possible so that it gives the viewer a very comprehensive outlook. And finally, I think this is a question we all have. Some of our fundus imaging capture devices does not have the montage function, but we are able to capture various regions of the FFA or your fundus. In that cases, it's a simple Photoshop work. You just need to take the different regions that you have captured and just cut off the black areas and use the retinal vessels as sort of a stencil to do your trace work. And you can align each image one over the other in sort of like a puzzle-like manner. And in the end, if you can see, you're going to get the beautiful ultra-wide field or the wide field photograph that you wanted to have. And finally, as I was saying, definitely some small work with the contrast and brightness. And finally, once we have done everything, this is an AI app that we use to enhance our images. So this is the Deep Image AI. This is a paid app which is available online. So you can upscale your images because, for example, this was one of our FFA images with the false color. We thought it had a very good outlook, but then you can see the pixelage over here, the breakup. So what we did, we just upscaled this image, and you can see the beautiful outcome of it. And you can see that it has completely removed all the artifacts and given us a very clear image. So do not hesitate to use upscaling, and as I was saying, focus on what you want to show more. This was the whole image, but we cropped out what we wanted, and again I enhanced the image, improved the contrast, the saturation, and the final outlook is something that we want. So what I wanted to say is, even in cases where you're doing a publication, tell your story how you want it. For example, this was our initial publication, which was a letter to editor, but we wanted it to be a sort of story told through images. So we actually had 13 figures in this publication, and you can see it started out with the local area network, how it connects different technologies inside your hospital, and then we showed where we kept all the instruments inside the hospital in another image. And finally, we showed them how to connect the technologies using the switch boxes. And then we went about to even show simple photos as where you're putting your LAN cable inside each machines, and finally how to set up the IP address inside your laptop, and how to set up the IP address in your fundus camera or your Sheenfleck image or your OCT image. And then we showed comparison between the EMR and the LAN network in cases of fundus images, comparison in visual fields in EMR and LAN network, comparison in showing the comparison between a visual fields and a fundus photo in LAN network. Similarly, fundus photo and OCT in LAN network, which is not possible in EMRs. And then we showed a difference between the hard copy and soft copy. So basically a total of 13 images for letter to editor, but that is our style and how we tell our story. So these are a few images. Basically this one, the 7 images won in our ACRS 2022 awards. So you can see this is how we work on each image. And then you can see that even if it's a small image, this is just an idea, but how you project it and how you finally upscale and bring out the perfect image matters. And these are, again, as I was saying, some of our images which won in the IARSA 2021. Multimodal imaging is something that we have to definitely look forward to, because it brings about a very different outlook. And these are some of our cover photos. Thank you.